Risk factors include recent surgery, open wounds, and the use of super absorbent tampons. According to this study, it's very rare. Fewer than 20,000 United States cases per year. So fewer than 20,000 cases of it in the United States per year. I'm not sure about worldwide, but I'm just looking at an article about toxic shock syndrome, and it's speaking of here in the United States. So toxic shock syndrome is treatable by a medical professional. It requires a medical diagnosis. Lab tests and x-rays or imaging is always required. It resolves within days to weeks. It may be critical, meaning that it needs emergency care. I've been asked this about Pure Lady menstrual cups. I was asked, does it cause or could it cause toxic shock syndrome? So let's see, how do people get toxic shock syndrome? Toxic shock syndrome can come from cuts, burns, or surgical incisions, or leaving tampons or other devices inside your vagina longer than recommended. So I was asked this question with menstrual cups. I was asked, could it cause toxic shock syndrome? Well, it says here that if you leave a device inside for too long or longer than recommended. Pure Lady menstrual cup. Pure Lady doesn't have tampons because we have reusable menstrual products. We're all about eco-friendly products, convenience. Since Pure Lady promotes sustainable living, eco-friendly products, we do not carry tampons or disposable pads. So for the recommended time to use a menstrual cup is to don't wear it longer than 12 hours at a time. Okay, let's see what this says about toxic shock syndrome. We're going to learn about toxic shock syndrome today. So how do you know if you're getting toxic shock syndrome? You'll have severe pain in your arms or legs or all over your body. You may have a rash that feels rough like sandpaper. The rash may look red. The palms of your hands, soles of your feet, tongue, and the whites of your eyes turn bright red, swollen, or peeling skin. This is how you know if you have toxic shock syndrome. You'll have some of these symptoms, or all of them, according to this article. How long does a tampon have to be in to get toxic shock syndrome? Tampons should be removed after 8 hours to lower your risk of toxic shock syndrome. So how often should you change your tampon? It's really important to choose the lowest absorbency necessary for your menstrual flow when it comes to tampons. And because your flow varies from day to day, it's likely that you'll need to use different absorbencies on different days of your period. Figuring out absorbency can be confusing at first, but let's make it easy. If your tampon is uncomfortable to change, go down a size. If your tampon leaks, go up a size. So let's learn more about toxic shock syndrome, because I've heard about it before. I've heard some companies were sued because of it. I've even heard with pads, you can get it from some pads. So what everyone should know about toxic shock syndrome. Okay, so toxic shock syndrome is rare, but it's a serious infection that is caused by a specific strain of a bacteria called Staphylococcus aureus. These bacteria are commonly found on the skin, in the nose, armpits, and inside the vajayjay. They're commonly found in all of those areas without causing any problems. However, under certain circumstances, especially when the body has not developed immunity to this strain of bacteria, it can grow out of control and release a toxin, which is like a poison. The toxin enters the bloodstream and can rapidly cause a severe illness that affects the entire body, which is the shock. It's caused by bacteria. In the 1980s, toxic shock syndrome became more well known because it was associated with highly absorbent tampons. Now, those highly absorbent tampons were quickly taken off the market. However, tampons aren't required for toxic shock syndrome. Anyone can get toxic shock syndrome. You can get toxic shock syndrome without having a period at all. Anyone can get toxic shock syndrome, even men and children. Only half of toxic shock syndrome is related to being on a menstrual cycle. Some other ways people develop toxic shock syndrome include insect bites, skin infections, or surgery. But it is rare. I hear about it a lot, but it is rare. So to put it in perspective, you're more likely to die from being struck by lightning than you are from toxic shock syndrome. There are also things that you can do to reduce the risk further. There are things that you can do to reduce your risk of toxic shock syndrome. It is treatable. So know the symptoms of toxic shock syndrome. So the symptoms of toxic shock syndrome is a high fever, over 102 degrees, body or joint aches, nausea or vomiting, diarrhea, dizziness or fainting or confusion, and sometimes there is a red rash. So if you are using a tampon and you feel very ill with some of the symptoms above, it's important to remove your tampon right away. Get immediate medical attention and tell the person you're with or a healthcare provider that you're worried about toxic shock syndrome. Now, there are ways to reduce your risk. Okay, so use the lowest absorbency tampon that will manage your flow. If you feel any symptoms coming on that I've mentioned, then get immediate medical attention if you are worried if you have it. The risk of tampon-related toxic shock syndrome can also be reduced by interrupting tampon use with pads from time to time. Pretty much don't always wear tampons. Sometimes switch it up with other products. So Pure Lady, we do not have tampons. We do not have pads. We have reusable menstrual products. The recommendation for the menstrual cups is to not wear over 12 hours at a time. The same as Pure Lady menstrual underwear. Do not wear for over 12 hours at a time. But follow the recommendations of the products that you use. And if you notice any symptoms that I said before, then just discontinue immediately. Speak to a healthcare provider and let them know that you feel you may be at risk of toxic shock syndrome and you want to get checked out. Will organic tampons reduce the risk of toxic shock syndrome? No. What you use is a personal choice, but the risk of getting toxic shock syndrome is the same from organic to non-organic. And it's also the same for cotton, rayon, or a blend of the two. The only difference in tampons that can increase toxic shock syndrome is the absorbency. A higher absorbency tampon have higher risk, and a lower absorbency tampon have lower risk. And that may be due to the fact that you have it in longer. So to reduce the risk of toxic shock syndrome, it may be better to change your protection often. So although the menstrual cup you can wear up to 12 hours at a time, you can take it out, for instance, at 8 hours, rinse it and reuse it. That way you won't have it in so long. I know toxic shock syndrome sounds scary because it deals with an issue that we have to tend to every month. Most of us have a menstrual cycle every month. So it's kind of scary to think that, wow, a product that I use may cause me toxic shock syndrome. But it is very rare. So if you just notice any of those symptoms while you are using a menstrual product, just stop using immediately. Speak to a healthcare provider. Is it possible to get toxic shock syndrome more than once? Unfortunately, yes. If you've had tampon related toxic shock syndrome in the past, you should consult with your doctor before using tampons. Most doctors recommend no tampon use if you've had toxic shock syndrome before. So how long can you wear a product safely without getting toxic shock syndrome? There's no exact answer for this one, but there are recommendations. The United States FDA and Drug Administration regulates tampons, and they state that you should never wear a tampon more than 8 hours. Most gynecologists also recommend you change your tampon every 4 to 8 hours for vaginal health reasons. We know that toxic shock syndrome increases with absorbency, and there is no precise time limit. So I know that's a lot of information about toxic shock syndrome. So here's a quick review. Toxic shock syndrome is rare but serious infection. Toxic shock syndrome is treatable, especially if you catch it early. You can reduce your risk for toxic shock syndrome. Pure Lady menstrual protection is super absorbent, which is great because it protects you all day while you have it on. With Pure Lady menstrual cup, all you have to do is take your cup out, rinse it off, and insert it. Or you can also get Pure Lady menstrual underwear, so you can give yourself a break. You can take out the menstrual cup, rinse it, put it in the storage bag, or sit it out to dry, then put on Pure Lady menstrual underwear. So that way you switch it up a bit. Also, know the symptoms. If you experience any of the symptoms while using menstrual products, stop use immediately and speak to a healthcare provider. Now that you have the facts, it's no reason to be afraid of toxic shock syndrome. All we need is a little education, and we're good.